Hello, how may I help you today?
I'm looking for the location of the continuing education on breast cancer.
Of course. That's just up on the third floor in the women's health classroom.
Great, thank you.
No problem. Enjoy! I've heard that's a fantastic presentation.
Welcome, and thank you for coming. Today we'll be discussing racial and ethnic disparities in breast cancer. Now, let's take a minute to introduce ourselves. My name is Emily. I'm an aspiring family nurse practitioner with a love of women's health, and I'll be doing your presentation today.
Hello, I'm Debbie. I'm a nurse practitioner over at Asheville Primary Care.
Welcome, Debbie, and everybody else out there listening from home. Okay, guys, let's get started. So apart from skin cancer, breast cancer is the most common malignancy diagnosed among women, affecting more than 1 in 10 women worldwide. In the United States, it is second only to lung cancer as the leading cause of cancer death among women. While the mortality rate of breast cancer has decreased in the white, non-Hispanic population over the past few years, the overall incidence of breast cancer among African American women has continued to grow. And when compared to non-Hispanic white women, African American women have higher rates of breast cancer before age 40 and are also more likely to die from breast cancer regardless of age.
I had no idea there was such a disparity in breast cancer mortality. Do you know why African American women die at such a higher rate?
Poverty seems to be the principal factor that underlies this health disparity.
So, how exactly does poverty increase the mortality rate of breast cancer?
Great question, Debbie. So, lower socioeconomic status is associated with diminished rates of breast cancer screening, which leads to late-stage diagnosis and increased mortality rates. The American College of Obstetricians and Gynecologists recommends annual well-woman visits, and it is during these visits that the provider would discuss modifiable risk factors for breast cancer, encourage healthy lifestyle habits, and it is also at this yearly visit that the provider and patient would discuss breast cancer risk factors and preventative screening mammography would be ordered. In fact, research has shown that having a primary care provider is one of the best predictors of compliance with breast cancer screening guidelines, and women with a primary care provider are more than twice as likely as women without one to have received appropriate breast cancer screening.
So how do we get these women to primary care providers?
Well, first, let's delve a little deeper into exactly how poverty contributes to this health disparity. So poverty is associated with lower levels of education and a lack of information regarding breast cancer prevention and the significance of early detection. African American women are more likely to eat a diet that is high in fat, low in fruits and vegetables, are less likely to get regular exercise, and are more likely to have a higher BMI than non-Hispanic white women, all of which are linked to poor breast cancer-related outcomes. Spirituality, cultural beliefs, and medical mistrust all factor into decisions regarding cancer screening, diagnosis, and treatment options. African American women are more likely to rely on divine intervention alone instead of seeking medical treatment. This can unfavorably alter their chances of surviving breast cancer. Additionally, African American women are more likely to receive hourly wages, meaning that taking time off work for healthcare visits directly detracts from their income. This can make it difficult for women to prioritize health screenings over other pressing needs such as food, water, safety, and shelter.
It sounds like we have a lot of work to do. Where should we start?
Great question. And yes, we do have a lot of room for improvement here. We should start with educating all women on the importance of following the recommended guidelines for breast cancer screening. We should aim to find ways to educate women on the known risk factors for breast cancer, including a focus on promoting healthy, culturally appropriate foods, increased consumption of fresh fruits and vegetables, and increasing physical activity. We also need to educate ourselves. We, as healthcare providers, should be cognizant of cultural beliefs and traditions that may alter a woman's decisions about breast cancer screening and treatment, so that any concerns can be addressed early in the patient-provider relationship. It is important to take into consideration that many African Americans have a general mistrust of the predominantly white healthcare system, and this may influence their decision to seek medical care, as well as their compliance with cancer screening and treatment recommendations. One final area where we can close the gap on this health disparity is in clinical trial participation. The National Cancer Institute reports that clinical trials frequently have less participation by racial or ethnic minority groups. This increases the probability that the results may not be completely applicable to them, and therefore, present and future research should strive to increase the inclusion of these groups. With some work on our part as healthcare providers, hopefully we can begin to eliminate the racial and ethnic disparities in breast cancer.